Hi, welcome, and thanks for attending today's webinar, National Hill Day Training and Legislative Update. I'm really excited to start the process of NAATP National 2023 and hear from Nikki Soda, Sherri Layton, and Mark Dunn, and start strategizing on the process of going and advocating for our field and our patients. Before I turn it over to them, I do have a few announcements. This is part of an ongoing webinar series hosted by NAATP, and we have a few exciting webinars coming up. In March, we have Love the Kid, Hate the Disease, talking about the family dynamic of addiction. In April, Dr. Carolyn Ross is going to be talking about the neurobiology of trauma and addiction. May, we will not be having a webinar, but we will be convening in Washington, D.C. for our national conference and Hill Day. And then in June, the compliancy group is going to be presenting on healthcare compliance issues. All of those will be great. I'll post a link to register for those in the chat. Following the webinar sometime next week, we'll send a follow-up email. That email will include a link to the recording from today's session, a PDF of the slides, and confirmation of continuing education. This training is meant to help people prepare for Hill Day in Washington, D.C., and it'll be readily available for you to re-review leading up to the conference. As you have questions, please type those in the question and answer panel. We'll be saving all questions for the end of the session, and we'll try to get through as many as we can. With that, Nikki, Sherri, Mark, thank you for taking time to present with us today. This is a really important topic, and we're excited to be doing a Hill Day again in 2023.
Thanks so much, Peter. Hi, my name is Nikki Soda. I am the Director of Membership and State Advocacy for the National Association of Addiction Treatment Providers, and I am elated to be here today to be able to present with Mark Dunn, our Director of Public Policy, and with Sherri Layton, who is our phenomenal Hill Day Chair. Each of them will talk a little bit about themselves when it comes their time to present, but the three of us have been working diligently together to work on presenting information for our Hill Day that we are really excited to be able to do again this year. It's scheduled for May 24th. It is going to be the day after the conference ends in DC, and how this kind of came about is in 2019, we had our conference in Washington, D.C. We had roughly 150 attendees that came to our Hill Day. And it was the first Hill Day that we had had in a very, very long time. And I had the privilege of working with Sherri and Mark on this Hill Day. And one of the things that came out of the experience was our members wanting to really engage more with our representatives and with policymakers. And so from that, we have been able to create some different state advocacy chapters. And so we're looking forward to an even bigger and better successful Hill Day than we had in 2019. I'm going to give a brief overview of the objectives and the agenda for today. Why advocate? I think most of us know why we do, but there's some other specific reasons besides just common sense reasons to advocate. Mark is going to go through our public policy priorities for 2023. Sherri is going to give us an in-depth look of how to prepare for Hill Day, what to expect, some information on scheduling appointments. We are going to talk about some of the resources that NAATP has to offer, our state advocacy toolkit, other very helpful resource and education tools that we have. And then we're going to talk a little bit about the conference session that we have scheduled on Tuesday, May 23rd at the conference, and really a wrap up of logistics for the day. And I do want to say this webinar is being recorded, and so we realize that we're a little bit ahead of schedule, but you'll be able to reference this at any point. And so with that, I'm going to turn it over to our Hill Day Chair, who's been so kind to volunteer her time and her wealth of knowledge to us to help create a successful Hill Day. So I'm going to turn it over to Sherri.
Thank you, Nikki. I'm so excited to have the opportunity to chair Hill Day again for NAATP. It was just great to be a part of the 2019 sessions that we had. And I think it was a great success, and we've gotten such great feedback from so many people that were a part of that, and people really wanting more. So I look forward to seeing many more of you in Washington this May as part of our national conference. I do want to just point out that Hill Day is a separate registration from the national conference. So just please make note of that and make sure that you register for Hill Day. And what that registration does is it helps us to organize advocates from each state, helps us to put you in touch with other folks that you will be working alongside of, very, very probably, especially for Senate appointments, and helps us to get you the information well in advance so that you know what to expect, and you have the tools that you need to prepare for your visits on Hill Day. So Nikki, will you? Okay. I love this quote, and it's been attributed to Elizabeth Warren, and I think it's actually been attributed to some other people as well. But if you don't have a seat at the table, you're probably on the menu. And what is so exciting to me is NAATP has a seat at the table when it comes to substance use disorder issues. And that is definitely to the credit of Mark and Nikki and Marvin and the Public Policy Committee and the PAC. There has been such great work done and has elevated NAATP's presence in Washington, D.C. amongst not just legislators, but also administrative staff and various agency staff. And, so NAATP now is an organization that the White House goes to, that the Office of National Drug Control Policy goes to, that key legislators go to get input on various issues, comments for the State of the Union address, those kinds of things. And it's so exciting to me to be a part of the National Association that is able to have that kind of influence and input into national issues. And that really is the credit of what has been done by the folks from NAATP, as well as the PAC and the Public Policy Committee. So I just applaud them. I toot NAATP's horn as often as I can. And I just want to give that credit. And so I really appreciate all that's been done. So I'm going to pass this off to Mark and let him go over the policy priorities.
Well, thank you, Sherri. To begin with, I want to second Nikki's thank you to you for all of your talent and hard work in helping put this together. As you always do, you step up to help NAATP in the field, and we sincerely appreciate it. And we also appreciate La Hacienda's willingness to let you do it. So thank you very much. Let me talk about the essential elements of public policy and influencing how that goes. There are three things that I believe are essential. The first is having someone on the ground who has experience, who has contacts, who understands the timing, understands the process, and can direct the rest of the activities for the association. There are a number of bills, over 100 usually, that are introduced every year that impact the field one way or another. And many times those are introduced by members to make a point or to be able to tell their constituents that they're doing something. So the ability to understand which of those actually has a chance of passing is an important feature and can save a lot of time and resources. The other thing that's important is the Public Action Committee, our ability to contribute to members who support us. We are the only political action committee in the field these days. As you might guess, some of our opponents on various issues, insurance companies and others, have enormous political action committees. So we're happy that we have at least one that has been, frankly, very successful in targeting our small amounts of money toward candidates who are supportive of our issues. And then the last thing that is important, last but certainly not least, is constituent contact, and that's all of you. I can go into an office and they appreciate NAATP, they appreciate what we do, but I can't vote for them, and you can. And that makes a huge difference in a congressional office. So your participation is very important and it really matters. Next slide. One way you can participate besides Hill Day is responding to our public policy updates. You, I hope, have seen them. Our goal is to send them out when there's something important that you need to know. It's either important to the field or it's a call for action. We don't send them out as fluff or willy-nilly. When you get them, I hope that you take the time to read them and then respond, because they're an important feature of what we do. And I can tell you they've made a huge difference on issues in the past. Next. Let me just briefly talk about some of the successes that we've had thanks to all of you. This is a partial list, but just to give you an idea, certainly the Mental Health Parity and Addiction Equity Act was huge. Maybe the most monumental things, one of the most monumental pieces of legislation that's ever been passed for the field. It was passed on a bipartisan basis, and you know, we've struggled for enforcement, but nevertheless, we will eventually get there, and it's going to make a huge, huge difference. The next thing that was huge was the Affordable Care Act and the fact that parity was included in that monumental bill. The good thing was that parity was included. The bad thing was that it required the states to enforce parity. So rather than deal with one federal government, we suddenly had 50 states to contend with, and that has slowed down enforcement considerably. But nevertheless, we've made a lot of progress. As they were doing the rules for the Affordable Care Act, you may recall there was a huge debate regarding whether or not residential care would be included as an essential benefit. Many people, because of costs, wanted to include outpatient only. NAATP stepped up big time. We engaged with Congress, and we got an overwhelming response, letters to the regulators, and as a result, residential was included as one of the 10 essential benefits under the Affordable Care Act. More recently, we've gotten funding for state enforcement of parity. Many states said they didn't have the funds to do it. So in the last appropriation cycle, we did get authorization for money for states to do that enforcement. One of the big major things that NAATP has done in recent years was our quality assurance initiative. We regulated not only our own members, but published a quality assurance guidebook for the field to raise the bar for everyone. As a result of that, we were asked to testify at a congressional hearing. Marvin Ventrell did a tremendous job on our behalf. And as a result, a number of things were passed, including making it a federal felony for patient brokering. So that was a really big deal. More recently, the elimination of the X waiver, something that we had struggled with for a few years. The MAT Act, which requires substance use disorder training for healthcare professionals, something we have been pushing for years. Telehealth extension. During COVID, telehealth rules were changed so that that was allowed, and we've gotten those extended beyond the COVID crisis. And also funding for workforce training. There is a loan guarantee program for individuals who want to work in the SUD field, and we've increased the amount of funding for that. So some things that are, I think, very important to the field. Next slide. So let's take a look at our priorities for this upcoming year. These could change. A month is a lifetime in politics, and certainly 3 months between now and the conference, some things could change. But we do anticipate continuing to push for enforcement of the parity law. We have a Department of Labor that has requested the authority to actually fine insurance companies who don't comply with parity. That needs legislative approval, so we'll be asking for that, I'm sure. NAATP's Quality Assurance Initiative is something that we probably won't be asking for as an action item, but it's important to include that in our packets as a leave behind so that members of Congress know that we care about that issue and that we've done a lot about it. The opioid crisis, obviously, that's what the media is focused on. And as a result, that's what Congress is paying attention to. It's important that, as important and critical as that is, that we remind people that there are other SUD issues like alcoholism, and people are dying of those every day as well. So we need to look at the entire problem. Workforce development, everyone knows that there's a crisis in terms of the ability to hire quality folks to work in our treatment centers. So we are planning on having some specific asks in that regard. And then lastly, we're going to begin the process to ask for a benefit for Medicare patients for residential SUD treatment. Up to now, that has not been available, and I think it's a huge parity violation, and it's a fairness issue. Medicare patients certainly should have that option. So we're working in a coalition to try to bring that forward. So those are the things that probably will be included in your packet. You don't need to worry about writing all this down. We will have it available to hand out to you at the conference so that you'll have it ready to take to the Hill when you go. And lastly, let me just say again how much I appreciate, as the person who represents you all with boots on the ground in Washington, your participation makes my job easier, and it really benefits the field. And I want to thank you very much. Back to Sherri.
Okay. Thank you, Mark. It's exciting, all the things that have been accomplished, and knowing that several of those things, it feels like that our momentum is growing. So many of those things have been recent. It feels like our accomplishments are getting just quicker and bigger, and that's exciting. But there's still a lot of work to do, and Hill Day is a great opportunity for everyone to participate in that. And so, just to give you some ideas of how to prepare and what to expect for that day. First of all, just between now and May, get to know your legislators. And first of all, and that doesn't necessarily mean you're going to meet them in person, but find out, if you don't know who your legislators are, find that out. You can Google that easily. Generally speaking, if you just Google who represents me, that'll take you to a website where you can enter your address. I encourage people to look at not just their home address, which is important because that's where you vote, but also your office location address. And for most of us, that's not going to be different because congressional districts are so large. But if your organization serves different states or different areas, then you have a constituency in those districts as well, because you are serving their constituents, even though perhaps you don't live there. So that is a way to kind of broaden our reach on Hill Day, is being able to contact those Congress people who you are serving their constituency, even if you are not their constituent. And then once you get, their names, look at their websites, and we give you a little cheater, for example, one of my senators is Senator Cornyn. So it'd be cornyn.senate.gov will take me directly to his website. And I can look at that. You're going to get a sense of what's important to your elected officials, They do newsletter, they post newsletters on there, they do post media releases on there. You can identify what committees they are a part of. So you can begin to get to know what's important to them, which can help you just in how you present your message. And then looking at relevant state and district data. So for your congressional district, there will be a map on the website, and what other treatment providers or prevention providers, recovery providers might be in that district that you can perhaps partner with and begin to collaborate on some district specific engagement with your elected officials. And then as you begin to have communication with congressional staff members, ask them if they have needs for specific information. And I'll give you some examples of some of those kinds of things, but they may ask you for your input on things. And so being able to be specific about what they may need. Nikki, will you advance, please?
I will, Sherri. I did want to interject one thing on the getting to know your legislators. Something that I have found very beneficial is to follow their social media handles. So particularly Twitter, the representatives and the senators here in the state of Florida are extremely active on. And so that's a very good way to be up to speed on some of their views or issues that they're very passionate about. So I did want to add that.
Thank you. That's a great point. So this is, bringing the issues home, and another great quote about politics is that all politics are local. And your elected officials, they want to know, why is this important in your district? And so one of the things that I put together several years ago for our congressional district is I looked at their map and looking just based on what I knew about the geography of treatment providers around Texas. And I pulled all the treatment providers and began to engage with them. And I put together a list. This is actually only a partial list. We have 21 treatment providers in the 21st congressional district. I always thought that was kind of interesting. And I asked ask all those providers, how many licensed beds do you have? What level of service do you provide in outpatient programs? How many outpatient slots do you have? And then how many people do you employ? Because that begins to represent to the elected officials, we're not just a single service provider, okay? We have, in our very rural district in Texas, we have over 500 licensed treatment beds, and we employ with over 800 outpatient slots and over 800 employees in that district in substance use services. And so that's more than just me speaking for La Hacienda. That is really being able to say, this is a big deal in your district. And if your district doesn't have that same kind of representation, that's okay. But just being for yourself to have that information about how much a part of this district is this, because we're not just treatment providers, we're also individual voters, we're also employers. And so we contribute overall to the district. Next slide, please, Nikki. And then beginning to look at, what kind of information can you provide that is specific to your district or your state? And this is one example. The University of Texas puts this report together every year, and it's Drug Trends in Texas. And this woman, Jane Maxwell, has been doing this for years, and she gathers information everywhere from DEA and other law enforcement seizures, emergency room visits, treatment admissions, all kinds of things. And she puts together an extensive report for Texas specifically. And I point out the first bullet point here, and this emphasizes what Mark was saying about that we need to be emphasizing more than the opioid epidemic. And this, her first bullet point says methamphetamine still outnumbers other drugs in 4 drug reporting systems. That is the DEA reporting systems, and it continues to increase. And so that right there substantiates what we're saying, that it's more than opioids. And this has been her opening line for her report in Texas for many years, that methamphetamine is a greater problem in Texas than opioids. And so although our elected officials hear all about opioids all the time in the media, it's our job to say, hey, it's bigger than that. And here's proof. Go ahead, Nikki. So just some general ideas as you start thinking about what information do you want to convey, that we are, we're the right message, we're the right messenger, and this is the right time. And this, an example, HR X passed, and Mark can give us, some information that's, in the omnibus spending bill that passed just at the end of last year. How has that impacted you as a provider? So what needs are still not being met? Okay. And so there, one example of that in that bill, licensed professional counselors and licensed marriage and family therapists were added to the behavioral health disciplines that could bill under Medicare. Addiction counselors were not included in that. So that is still a need that needs to be met in that particular example. And so, being able to look at some of these things that we've talked about in the past, some of the progress that we've made, but to still be able to say, that more still needs to be done. And so that parity is a great example of that. We make parity progress in incremental steps, and we still have incremental steps that need to move forward. And then this, as Mark has talked about in the past, healthcare is just this universal campaign issue, and helping our elected officials understand that behavioral health, substance use treatment is a part of overall health. And we know the impacts to an individual's physical health with untreated substance use, untreated alcohol use. And so there is, for that idea that we are, we're impacting bigger issues than just substance use disorder prevention, treatment, and recovery. But that all of those things are good investments. The dollar that is spent towards substance use treatment equates to dollars saved in terms of criminal justice cost, healthcare cost, the impacts on foster care when parents have untreated substance use disorder. And so so many of our societal ills can be directly impacted by effective treatment of substance use disorder and prevention of substance use disorder as well. And so, beginning to think about those things and why does this matter in the bigger picture of all of these different issues. And I know this is probably, this would be considered very crass, and I apologize for that, but it's a true story in that the lobbyists that we use here in Texas for state level legislation, one year we received a significant increase in funding for substance use services in Texas. And after the session, he came to our group and he said, y'all finally stopped talking about saving lives and you started talking about saving money, and look what happened. And as sad as it is to put it in those terms, very oftentimes the financial cost of untreated substance use or not having effective prevention programs has a bigger cost on society that impacts tax dollars greatly. So thinking about those things, how can we connect it to all of these bigger picture items? Go ahead, Nikki.
Sherri, I just wanted to add one more thing on weaving into your message. When you are going in and talking to your public policymaker, you're coming in as the expert. And so being able to weave and combine part of your personal story along with research, data, and the numbers, as Sherri was just talking about, being able to combine all three of those is extremely impactful. And I believe what you'll find when you're talking to a number of the representatives is that you'll find that, quite a bit more than they do on the issues that you're dealing with day in and out. And so being able to combine those and really making an impactful message when you're visiting with them makes a tremendous difference.
Definitely. I think the question that we get asked the most often from participants in Hill Day, or participants thinking, those thinking about participating in Hill Day, is how do I schedule appointments? And we want to help you with that. And so as you register, and that's one of the important reasons that you need to register independently for Hill Day, we will begin to look at state groups, and we will identify within that state group a Senate lead. And that person may be you. You may want to volunteer for that. And if you do, we would love to hear from you about that. But we will ask that that kind of state lead person to schedule the 2 Senate appointments. The reason for that is we want the full group from that state. So for example, from California, we want everybody from California to attend those Senate appointments. And so we want to make those at a time that doesn't conflict with your other appointments. So we would ask the Senate lead to make those appointments early on. And then after that, you have all the registrants from that particular state will have that time to work with. And then you individually or a smaller group of folks from the same district will set up House member appointments. And so there may be there may be 10 people from that state for a Senate appointment, but there may be 2 or 3 people from the same district. And we would want you to coordinate your appointment times for the district as well, so that you're not coming and going with that office. That, I was in a situation one time where they said, oh, the last guy, he was just here talking to me about these things. And it was embarrassing to feel like, oh, we didn't coordinate that very well. And so we want to coordinate well because, one, it makes good use of their time. We're showing respect in that way, but we're also showing, our collaborative ability and our professionalism. And then as Mark said, a month is a lifetime in politics. So, we'll start these things about a month out from May the 24th. And we will also provide you, whether you're a Senate lead or whether you're just working on your district appointments, we have scripts that you can use for a phone call, scripts that you can use for an email, and we will help you with that so that you really can just kind of plug in a few key issues and copy and paste into an email to schedule those appointments. And I just, oftentimes our expectation is, oh, I have to meet with the senator or I have to meet with the representative. And the truth is that staff members are key in those offices. And, they are the key gatherers of information. They are the people that are tracking what kind of feedback they're getting from constituents on these issues. And they are charged with focusing on particular areas and being the expert for the elected official in those areas. And so, most offices are going to have an individual who focuses on healthcare, and that is our target person. I always seek out the staff member who handles healthcare issues. And I don't ever really have an expectation of meeting with the elected official. I want to build that relationship with that person that handles healthcare. And so that's generally where we start when we are talking about individuals making their appointments, is contacting the office and asking for the name and the email address of the staff member who handles the healthcare issues, and then working from there to set your appointment. And sometimes they automatically bring in the congressperson or the senator. You can ask for that as well, but please never feel like you have accomplished something less than if you have met with a staff member versus meeting with the elected official. I have developed some very effective relationships over the years with staff members, and they're much more inclined to reach out to me than the elected official would be to get information that they need. And I'm going to, Mark, is there anything else you want to add to that? You're in and out of those offices all the time.
No, other than to say you're absolutely right, Sherri. Those people are in those roles for a reason. They're trusted by the member of Congress or the senator. They tend to be very bright individuals, and they're trusted by their bosses. So, if you get to see the representative or senator, that's great. But please don't be offended if it's a staffer, because they oftentimes can do just as much or sometimes even more because it's their area of expertise and responsibility. So absolutely right.
Sherri, I was going to share an example. I was in Tallahassee last Wednesday for a Hill Day here in Florida, and we had an appointment with a newly appointed or newly elected representative, and her main chief of staff had been around, was very well seasoned, and she was not familiar with any of the issues. And meeting with her chief of staff, he wrote down 3 names of people that we needed to reach out to and email addresses that the actual representative didn't know or would not have known to do. And so I think that that's a really good example of ensuring that you take advantage of whomever you are able to meet with, because sometimes the legislative aides can be more beneficial than the actual representative.
Definitely. And you may also be surprised at how young some of these people are. And sometimes it's a little disarming to go, okay, our government is run by children, but they're not really children, but they just seem very young sometimes. But as Mark said, they're incredibly bright. And often very, very committed to doing this work, and they become great experts on their particular areas that they've been assigned to. Go ahead. This next couple of slides is just as you're thinking about these appointments, location, location, location. And at the top of the slide, you'll see this circle. Those are the Senate office buildings. And at the bottom, you'll see this circle. Those are the House office buildings. And it's about a 15-minute walk from one side to the other. And then you have, getting into the buildings and finding the offices. And I think they made government office buildings particularly maze-like in their numbering systems, but it takes a little planning. But so, if you have a Senate appointment at 10:30 and you say, oh, okay, I'm going to run over to the House and I'll be there at 11, that's not going to happen. So just give you this as just a heads up kind of thing in terms of your own planning and timing. Go ahead, Nikki.
Before we go to the next slide too, as a woman who wears heels, this point gets brought up later in this presentation too, but wear comfortable shoes, because you are walking around so much and the floors are marble there in those buildings. And so I do want to add, be sure that you wear comfortable shoes.
Definitely. And then this is maps of the House office buildings. There's 3 House office buildings. And so this shows you how they are numbered. So you can plan a little. I oftentimes do multiple House appointments. And because I'm trying to cover a number of districts, we have 36 districts in Texas. We try to cover as many as we can. And so this helps me to know the travel time between the different buildings. It's also great that there are underground tunnels between the House buildings. But so once you get past security into one, if you stay inside and use the tunnels, it will help you greatly to move between the buildings quickly. And then we're going to talk about the Capitol Hill Hotel in a few minutes, well, right here. And it is just 1 block down from the House side. And so we will have that day, for your convenience, a room in the Capitol Hill Hotel, a meeting room in the Capitol Hill Hotel. So if you need, if you have a couple of hours maybe between appointments, it just worked out that way. It's a place for you to come and relax. There will be a Mark, or there will be other individuals there that you can share your experiences with, that you can get questions answered, that you can ask for help with things. You can store your luggage there if you're going to head to the airport from Capitol Hill and you don't want to make the trip back to the hotel. And then there will be some light snacks that day for you as well. So that is a helpful
Mark will be there, I believe, most of the day, correct, Mark?
Yes, planning to be there if you have questions or something you need to relay after a meeting. I'll plan to be there.
It's a nice place. It's a nice location too for your group to congregate, because it's a nice central location. So please feel free to take full advantage of our rooms here.
Yeah. And then just this is a little bit more kind of like a few days out, but just to help you be thinking about those things. As Nikki said, wear comfortable shoes. I generally have a pair of I carry a small bag, and I have a pair of walking shoes, and I have a pair of appointment shoes. And I switch back and forth between those. And remember your business cards, plan where you're going, the timing issue with the maps. If there's more than one person from your state or from your congressional district, we're going to help you connect. We're going to put you in touch with each other before Hill Day. And we hope that you will make those connections before Hill Day. We will ask you to, the day before Hill Day, when we're having our session, we'll ask you definitely to connect at that point. But we want you to coordinate your visits with your senators and with your Congress people. And then be thinking about bringing that topic home. And so, how do the issues play out in the district? What are some specific examples and facts relative to your experience? And one example is the Medicare issue and adding the full continuum of care for under Medicare for beneficiaries. We have individuals who contact La Hacienda seeking treatment that have Medicare, and we cannot treat them because Medicare does not have a benefit for coverage at La Hacienda, and so we have to tell them no, and it's not that we can refer them to another facility that does take Medicare for residential or inpatient services. There's no benefit for residential or inpatient services, and we have to tell them that. So I asked our admissions department last year, a year and a half ago, I said, would y'all just please just take a number, just count how many people between now and X time contact us that have Medicare that we can't treat because they have Medicare. And it was 39 individuals in 3 weeks that were turned away from treatment because they only had Medicare and there was no coverage. And so that was a specific fact that I could take into an appointment having this conversation. And it puts something very real on, to this issue. So it's not just, 39 people. This is 39 people over 3 weeks at one treatment facility. Now multiply that, spread that across 52 weeks in all the treatment facilities across the country that can't treat individuals that have Medicare. And you begin to see how monumental this problem is. So take the time to do something like that. Ask the person who leads your UR department to pay attention between now and May. What kind of denials are they getting? When do they suspect that there's a parity violation? Are they having issues with authorization that seem to show a pattern with a particular insurance company? We still occasionally find quantitative treatment limitations for random policies. We've cleared a lot of that up, but they still show up every now and then. So what specific examples can you bring to Hill Day that support the issues that we are saying still need attention? So those are a couple of examples of things that I've worked with in the past and that I will definitely be bringing to this Hill Day. And then just remember, we are there to talk about one issue, and that is the substance use prevention, treatment, and recovery services, and the need for services and the magnitude of the problem. And so there are a lot of hot button political issues, and I just really encourage you to hold on to your passion about those other issues and save them for another day. This day, May the 24th, we are there to bring all the attention to substance use disorder services. And so, if you want to come back on another day and wave the flag for some other issue, bring everything that you've learned from this experience and apply it to that. But that day, talk about one thing. And then also remember, it is so key that we approach this from a nonpartisan standpoint. Addiction has become a nonpartisan issue. They really see that it goes across all communities, all populations, all demographics. And it's getting nonpartisan support like it never has before. Nonpartisan, it's getting a cross-party line support like it never has before. And so we don't want to come in and bring a specific, we don't want to make this a Republican visit or a Democratic visit. We want to make this a nonpartisan visit. And then also get to the point of what you're talking about and have clear ask. And we will help you with that. We will have papers for you that specifically say, here's the ask. And so as in all visits, there's a brief, hello, how are you? It's nice to see you. There's a brief personal connection, but then we need to get to the point quickly, because if you have 15 to 20 minutes, that's about all you can expect for these visits. Go ahead, Nikki.
But I was going to add to that too. You do have a very short amount of time. Sometimes if things are going well, they will extend the time a little bit, but be prepared to strictly stick to your points and have that ask, because the policymaker more than likely is going to say, well, what do you want? What are you here for? And so to be sure that you are very clear on that and that you get to the point. So wanted to reiterate.
Yeah, they usually give you about 15 minutes is all. So be ready for that.
Yeah. And, as with everything else across the population, so many people are personally impacted by substance use. And so it's very possible I have had folks that I've been visiting with share with me some very personal stories about loved ones or their own experiences. And so that may happen as well. And if it does, that is a great opportunity to connect. And then the secret of advocacy is all about relationships and follow-up. And the follow-up helps to build the relationship. And so be sure that you say thank you with a note or an email. Any information that you promise them, make sure that you follow up and get that information back to them. If you don't know something, it's fine to not know, just, the standard I'll get back to you on that. And then come up with reasons to stay in touch and become their expert. If you come across an interesting article that supports some of the things that y'all discussed, pass it along in an email. If there's a specific statewide report or something that is, would be helpful, again, to bringing that information home, pass that along. Don't be, that helps that you become the person that they look to when they need information. And then look at engaging, once you get back home, look at engaging with the district staff. And we'll talk about that a little bit more when we're in DC. But I have had great success working with district staff for federal officials. And so there's lots of reasons to engage at that level. So I just want you to be thinking about that.
Thank you. Thank you so much for all of that really helpful information. After my Hill Day at Tallahassee, the Florida Alliance for State Advocacy, we went up there and met with 5 or 6 different representatives. And from each of the follow-ups, I received a response. And in the follow-ups included resources and questions that they had asked for. And so they do listen, and those resources are highly valuable. And one other note that I wanted to make is, this seems like a common sense thing, but don't make things up. So if I was with a group of teen ambassadors in one of my meetings, and someone touted off a statistic that was not correct. And so not that would happen at all in this group, but be sure that what you're saying is research-based. And if you don't know, simply say, I don't know, and follow up appropriately with that information, but don't ever make anything up. And Sherri, are we good to go on to this part?
Yes, please.
So NAATP offers a number of very helpful resources and tools, and Mark does an excellent job of providing public policy updates on a regular basis when that information is necessary and needed. We have a number of webinars that have been recorded and saved, and they are listed, or they are kept on our website under the advocacy tab. And so we have these three right off the top that are available and saved on there that contain some really informative and helpful information. And so one of them is from Sherri, and the other one is from Jason from High Watch Recovery, who is a state representative. And so those are worth checking out. And so we also have our NAATP advocacy toolkit that we launched at the end of 2019. And it contains a wealth of resources to help that I would highly encourage you to look through before you go to Hill Day. It just dives a little more into the minutia of things that can help you and build your confidence before going into your one-on-one meetings. It's located here under the advocacy tab on the website, and just a couple of the bullet points that it goes through is helping to develop your message, helping to craft your message to ensure you get to the point and you don't go not necessarily off script, but that you're sticking to a clear, concise plan, that you communicate like an advocate. So weaving in appropriate data, weaving in research and real life examples from your treatment center and how they impact the community and really how it impacts their constituents, because that's what they want to hear, and that's what's going to make them want to do some action. And then the last part is not so much for this one. And so the next steps that you can do, you can make sure that you are receiving our public policy alerts. And so there is a tab on the website under that advocacy to ensure that you are receiving those. Stay up to date with substance use disorder information. And so there is a number of different resources to be able to do that. But NAATP, we work really diligently to ensure that we're putting out the most up-to-date information. SAMHSA and ASAM are two other organizations that are really helpful in ensuring that you are staying up to date. Want to strongly encourage you to sign up for your state alliance group. And so right now we have 5 active, and our goal is to have 12 very soon. And so if you are interested, you can reach out to this email, or you can reach out directly to me, and our contact info will be at the bottom. Or excuse me, on the last slide. And I do want to give a shout out to Ashley Neal, who is currently our Florida ASA lead. She has done a phenomenal job and helped rally the troops for our Wednesdays Florida's ASA group. And if we want to work in tandem with other groups that are going on. So for these state advocacy groups, if you know, Minnesota, for example, has a very thriving substance use disorder advocacy group. And so we're looking for information on those. Sherri is in Texas, and TAP, which stands for the Texas Addiction
Association of Addiction Professionals.
Gosh, I will get it right eventually. And so we're looking to work in tandem with those state groups. And last but not least, we are going to have a Hill Day session at the conference. And so it's Tuesday afternoon from 3 to 4:30, and we are going to have briefings on policy and legislation. We are going to review our Hill Day leave behind packets, and we'll literally provide you with every bit of information that you'll need to know. So there is no reason to be nervous or to think I don't have experience to do this, because we want anyone and everyone to come. And this session will really help prepare you for to ensure that you have everything that you need. Mark, Sherri, myself will all be there. We are going to have Scott Munson, who is the chair of our PAC, and Robin Piper, who is our director of public policy committee. And is there anything else, Mark and Sherri, that you want to add about our Hill Prep Day session?
I think just that, we want you to feel prepared. Nobody likes to go in and just feel like I'm a talking head. I have these things to say, and that's all I know how to say. So we want to do everything that we can, and we will help you do that. And for many people, this feels incredibly intimidating. Oh my gosh, I'm going to go talk to these people and I've never done this. Just remember, you are the expert on these issues. And so you have so much more information than the person that you're going to be talking to, and you really are bringing to them very needed and very helpful input. And so, it's we want to help you increase your level of confidence. And if you're feeling something like, oh my gosh, I don't know if I can do this, I I did, I had my first trip to the Hill. Nikki had her first trip to the Hill. We all have to start somewhere. And we want to help make this opportunity for you as successful as possible. And please don't feel like, oh my gosh, I can't do this, because you definitely can.
Yeah, absolutely right. And remember, they work for you. You are the expert, and please don't be nervous. I know that it can be intimidating, but most of the people who participated last time for the first time found it to be a really rewarding experience, and they really enjoyed it. So come and have a good time and help the field.
And I will end with the Hill Day in 2019 really ignited a passion for me with public policy. And it was my first time, and it was such a positive experience that I wanted to do a lot more of it. And I found that a lot of the attendees from 2019 have felt the same way. And it's been exciting to see them be able to go out into their states and be able to recreate some of the things and continue the advocacy movement for NAATP. All right, so I think we might have a couple questions and answers. Pete, do you want me to read these off?
Thank you, Nikki, Sherri, Mark. We do have a couple questions starting to come in. Do you have any advice or experience with navigating the conversation around advocacy for access to treatment when you live in a more controversial district where corruption is notorious and community pushback with movements like Not in My Backyard are active?
Yeah, I would say that it's important in those situations to highlight what NAATP has done around ethics and quality assurance, and that you're part of that. We don't condone those other activities, and we're working hard to try to limit those. So you need to distance yourself from what's going on so they understand that, you are an ethical quality treatment facility.
Thanks, Mark. I'd guess that Nikki might have something to say on this as well, but I'll jump in and answer this. I have some experience in Arizona. And since I'm not part of the webinar, I'm Peter Thomas. I'm the Director of Quality Assurance at NAATP. And I was pretty active in Arizona when Arizona was starting to inherit a lot of the problems that we attribute to California and Florida. Those, of course, are not alone, but they got the highlights. And when we saw that in Arizona, there was a lot of not in my backyard. And I think that it's a problem when you're advocating, and it can also be an opportunity in that we want to provide really good, high quality care for patients. And if we're providing really good, high quality care, it's going to be a benefit to the community. And so by advocating in ways that you can find that mutual benefit, some of those people can become allies, which is what we had in Arizona. The people who are trying to introduce legislation to shut down the recovery industry became allies in promoting laws that would give better access to better care.
And just to add to that, Peter, I do think the specific question that those issues may be more related to state and local level advocacy, because oftentimes it's counties or cities that are wanting to pass ordinances to prohibit. The state, sometimes we currently have a bill active here in Texas for voluntary recovery housing certification. So those may be more local issues. And as Nikki said, engaging with others, that are in your state or in your district, that general area, can be very helpful. But that may be where that attention may need to focus, is more at the local or state level.
Great, thank you. We are about out of time. Mark, Sherri, Nikki, thank you for taking time to present with us today. This is really important. Everybody who attended, thank you for attending. We hope that we'll see you at NAATP National in Washington, D.C. There's a link to register in the chat. If you have follow-up questions, feel free to reach out to us. You can email info@naatp.org or submit a contact us form. There are email addresses up on the screen currently. You can email Mark, Sherri, and Nikki directly. We want to make this a success, and we want to provide all the information you need. So look for continuing communications from NAATP leading up to the conference and about Hill Day. Thank you all again for presenting. Thank you for attending today.
Yeah, we hope to see you in DC.
Yes.